you could see that you're able to roll over the face very quickly. Okay. While Nadia's doing that, are there any questions? Yes? I'm sorry? Okay, well, I'll tell you, that's a great question. With which device? This device, the 1550, for instance, it will tell you how many passes are recommended, okay? With this device. With an IPL, it depends on the patient, okay? It depends on the number of treatments. So the first time, I always say safety, okay? You could do, there's always a tomorrow, you could do 1 pass, maybe 2 passes, that's it. It really depends on, when you talk about erythema, for instance, of the face, the different types of erythema. There's very strong erythema and very light erythema. So if it's a very strong erythema, I know that there'll be so much absorption of the light that they'll be very swollen, so I'd rather go on a light side. And the second treatment, I can increase it. So, you know, the other thing about maybe doing 2 passes, you may want, with an IPL especially, use 1 pass vertically and horizontally, like that, and maybe use a little less energy. You also have to gauge the patient's pain threshold and how they're doing. But the nice thing is, again, you have a lot of, you put in what the situation is, what skin type they are, and it does guide you. So it's, any other questions? Yes? When there are different ways of doing that. I personally would do the fracs first. That's what I do. On one hand, the IPL goes a little deeper so that you want to always go deeper. On the other hand, my concern with the IPL going first, if there's any edema, so I think that's going to be taken up by the target of the fracs. So, yeah. So again, when do you use this device? You use it for stretch marks, for acne scars. So the nice thing is, for wrinkles above the lip, around the eyes, you could do it for the whole face. But really, a wonderful rejuvenation would be using the 1550 for collagen production, followed immediately by the 1940 for the epidermal pigment. And that would really be a high-end photo rejuvenation procedure where you really are creating new collagen. And collagen, when you create collagen, lasts years and years. So it's better than other type of injectables. You can really do that. You could do this on the neck. That's also something else. A lot of the ablative lasers you cannot use well off the face. This device you can use on the hands, on the neck, on the décolleté. So you have a lot of much more options than you do with an ablative device. And you can see it's really not painful, or she has the emblem, but in any event, it's really not that painful. Also, I'll tell you, dealing with warts, the thing is in Israel, I just had this morning somebody contacted me, and a Kupa, all they're willing to do is liquid nitrogen. Now, using liquid nitrogen on a plantar wart is really not that, it's not going to really work. So with this device, you're able to use the vascular wavelengths in order to treat warts. And the advantage of doing that, we don't do the CO2 anymore. I mean, that they do in some hospitals. I think it's barbaric, because when you do that, you get scars. and people can't walk for a while. And so here, what I'm going to be doing tonight, if I get home with all the demonstrations, is a big wart on the bottom of the foot, anesthesia, scraping, and then using both YAG followed by the vascular handpiece, and they'll be able to walk the next day. So that's the warts are very big, and nobody's really doing them well. So you know, just going back to the coupa and having them freeze it and freeze it and freeze it, you know. So this is really a really good area to become an expert in, and having two wavelengths, having two vascular wavelengths is really very nice. And so this is pretty comfortable, especially if you have a Zimmer. You know what a Zimmer is, the cold air machine. So that makes it very, very comfortable, which I also, by the way, I really recommend, because it not only is for comfort, but it's also for safety. And you can see that these people generally have problems with texture, wrinkles, and also pigment. So you really want to be able to use both wavelengths, the 1550 for dermal and the 1940 for epidermal. And if you don't go for the lasers, you still have a great IPL. The IPL will not give you the same collagen production as this laser. And it's not me. An IPL is probably the best for popliteoderma for all diffuse redness, especially redness that is associated with pigmentation. That's the neck. The neck is redness and pigment. On the face, in one area, it's usually redness or pigment, but in the neck, popliteoderma means redness, pigmentation, atrophy, and telangiectasias. So that's where the IPL works great. There are some reports how this device causes skin tightening, but you know, I wouldn't sell it or market it like that. If it happens, we'll take it, but it's primarily, it works fantastic for acne scars, especially in dark-skinned individuals. And when you combine the 1550 and the 1940, so you're really going to get the best results, because you're dealing with the dermis, which is most of it, and also the epidermis. So you really can get full coverage and get a great result. So this is the same procedure for acne scars, also for stretch marks. I have in the past been using the CO2 laser for stretch marks. It works for white stretch marks. By the way, just 1 minute on stretch marks. Stretch marks are red or they're white. New ones are red, old ones are white. New ones, the red ones, vascular. So you want to use here the IPL handpiece for the red ones. That works well. What happens when they turn white? So then what happens, you have to use, the problem is it's a scar in the dermis. The problem is you want to create collagen. How do you create collagen? Either you use a fractionated ablative and then you look terrible for 2 months. Always afterwards, there's a good result, but you look terrible for 2 months. Or use the 1550. 1550 creates collagen. The downtime, looking bad, is days as opposed to weeks. So it is attractive, especially to people with dark skin. You don't have that risk of PIH, post-inflammatory hyperpigmentation. So if you think about it, what I like about these devices, you could literally treat a child all the way up to everybody, men, women. And besides warts, I also use these to treat molluscum, because most people are told molluscum, they'll go away, they come in, the child, no one wants to play with them and gone, and they're contagious. So I use a vascular device in order to treat molluscum. So it's also another indication. So that's what I'm saying. You have so many, you're really covering most of dermatology with just one machine. And what you're not covering, you're not using a fractional ablative. Fractional ablative is more aggressive, a quicker result, but a lot more potential risks. So if you're risk averse, you don't want to have the headaches, people calling and saying that they're either having a scar or an infection, or so non-ablative is really the way to go. And you have a great non-ablative video. And in combination, you're really getting results that are very significant.